Dr. Bradshaw with Chirocynergy here. We're talking about stretching out the hips today. In this case, we're going to be working on the hamstrings. So the hamstrings run from buttock down the back of the leg to the back of the knee. They run like train tracks. There are two of them. They run parallel down the back of the leg, right? We're going to get both parts of this. Here's how you do it. I recommend, let me give you the easy way first, or the easier way. Feet together. I'll show you this way. Toes pointed this direction. You're just going to bend forward. You're going to reach for your toes, keeping the knees straight. Some of you can't get past this. That's okay. You're just going to stay right here. You're going to hold it and take deep breaths. If you can go further with the knees straight, see if you can get the toes all the way down or the fingers down, reaching for your toes. Okay? You're going to hold that for a count of 10. Okay? Once you're down there, you can't go any further. You hold 1, 2, all the way up to 10. Okay? You'll feel it going all the way down the back of the legs. Now, some people that might irritate your back, you can also do it on the floor the exact same way. You just get down, move the flesh out from underneath your sit bones, feet flexed up, reaching for your toes like this. Okay, again, holding your count of 10. I don't like this as much because I feel like you don't get as much stretch on one hamstring or the other. I prefer to get one leg in at a time. This works better for me. So use the side of a piece of furniture, couch, bed, whatever. You're going to get your leg up like this. So you have one leg going forward. The other leg is also pointing forward. I don't want the leg turned out like this. Okay? You want to get the hips pointing the same direction so we don't twist the low back. Knee locked. Bend forward, reaching for the toes. At the very end, tuck your chin down. That will increase the stretch. Okay? Now you can do this near a wall. If you feel like you're having some trouble with this, get over here near a wall for balance here, bend forward. You can always use your hand here to help you to keep you from falling over, okay? We're going to do one leg. You're going to get it up there. You're going to hold it for a count of 10. When you're done, bring it down, do the other side. Same thing, lock the knee, bend forward, reach for the toes, tuck the chin at the end, hold it for a count of 10. All right, that's one cycle. We're going to do 3 cycles, so morning, middle of the day, and the evening. If you have a historically chronic tight hamstring, every time you sit, you put pressure on it, those structures cannot get blood flow they need to loosen up. So you probably sit too much and you don't stretch enough. So find yourself doing this a lot more. I've had some patients need to do this every half hour for 2 weeks straight to get that to finally break down, along with treatment to fix it. These areas they're just very hard to heal when you've had a hamstring tear if you pulled a hammy. So this is the best way to do it, I feel like. If you stick with what I tell you to do in the office and you're doing this outside of the office, it will get better, I promise you, but you got to be diligent about it. All right, have fun.